Hi, my name is Brittany Wilson. I'm an outreach peer here at Bay Area First Step. I identify as a person that was living with substance abuse disorder. I'm currently still suffering from mental health disorders, but I work through those things every single day. A little bit about myself. I was a child addicted to drugs I started using methamphetamines at 12 years old. And then I started using intravenously at 15, and I struggled for years with substance abuse disorder. I just celebrated 3 years clean, November 7th, and it's just been an amazing journey since then. I started working for Bay Area First Step January 2023, and I became a Prime Plus peer May 2023.
My name is Roland Block. I'm a Prime Plus peer with Bay Area First Step. I'm a person that identifies with lived experience with substance use, houselessness, and justice involvement. And I'm a person with living experience with mental health.
Our agenda today, we're going to talk about some of the services we have here at Bay Area First Step. We're going to talk about harm reduction and STI treatment, and we're going to talk about some lessons learned. Bay Area First Step, here we have NAR accredited recovery housing. We have 5 facilities. 3 of those are shorter term stays, and 2 of those facilities are permanent housing. We have peer delivered services. We have our departments kind of separated out. We have housing peers, we have SUD treatment peers, and then we have our services department where most of us are Prime Plus peers. There was just a couple of us Prime Plus peers, and then recently we upgraded to eight Prime Plus peers. So we're doing pretty awesome. We also do have SUD outpatient treatment services. We're going to talk about Prime Plus and core program elements, peer support, any positive change for people who use drugs. We support people's self-identified goals for health, well-being, and quality of life. We provide harm reduction support and tools, connect people to recovery supports and substance abuse treatment. We link people to healthcare, including infectious disease care. Program supports peer specialists to maintain their own recovery and well-being and expand professional skills. We just love Prime Plus being part of this collaborative. We're provided all the tools that are needed as far as supplies go. We're really grateful for our Save Lives Organs grants that we get, so we can provide harm reduction supplies, wound care kits. Something that I'm personally passionate about is like MRSA awareness. So we were able to get the Hibiclens, and so I educate people that are out there that are vulnerable to infections with staph and MRSA, and I educate them about that.
One of the things I do want to touch on is just giving some credit to our leadership and them giving us the autonomy to identify the needs that are in the rural communities that we serve. Coos and Curry, they just allow us to be boots on the ground. So it's really amazing.
And one of our other favorite things to do is to go down there and track down HCV and connect them with paths. That's something that our team is super passionate about, and we've had really good outcomes with that. And we're able to, work with our community partners and innovate new ideas and ways to connect people to those services that they need. How people connect to Prime Plus peers. So community partners make referrals. Some of those community partners are corrections, hospitals, doctor's offices, even sometimes. We work closely with public health, and we get those referrals from Nurse Debbie Richardson, who is a nurse epidemiologist. We get referrals from HIV Alliance. These things work really, really well, and we have really good relations with these people and these organizations. Peers do direct outreach to engage individuals in the community. And so how we do this is our mobile outreach. That's something that's really successful. We have our fixed site outreach events sometimes here at Bayview, and then we have our pop-up outreach events in different various sites within Coos and Curry County. Anything to add on that?
Yeah, some of the pop-up outreach sites, we call them connection points, and we have several other of our community partners, including but not limited to Youth Era and Adapt and DHS. So it really gives that individual that we're serving the feeling of being that wraparound care.
And individuals can self-refer. And so that's the thing about getting out there in the community is making our name and ourselves known. And the benefits of us going out there into, for lack of a better word, trap houses, into the camps and knowing the people that we used to know in our addiction, they know what we do. And so they know where to come and where to go. And so we get a lot of self-referrals from word of mouth or from people that we've previously worked with. BAF's Prime Plus number reached. So this data is from 2022 and September 2023. And so these numbers are a little bit different right now. So BAF's, we have 583 Prime Plus peer services participants since December of 2022, which, like I said, again, those numbers are way higher now. And 3,535 total participants contacts with a peer. 98 participants tested for HCV, 46 were positive, 32 had received treatment. I was just looking at some data from our PATHS data, and I know as of November 12th, there was 79 cures across the state of Oregon for HCV. And I know roughly half of those are from our organization, those cures. So that's pretty awesome numbers. We're excited about that. We're going to talk about PATHS, which is peer-assisted telemedicine for hepatitis C and syphilis. This is something that, like I said, again, we're super passionate about. PATHS, peers help people with lab testing, connect people to walk-in HCV clinician visits, and help people get medications. Peers help people stick with taking medications, calling, texting, going out to locate participants to maintain contact. This is something that we do on a daily, and it can be extremely challenging when someone is engaged in treatment and taking their meds because of the population that we work with. A lot of these people are houseless, are actively using or in vulnerable states. And I personally have had to track down people like every 3 days and check on them and find them and bring them to their meds. But we've had so many successes. And this is because of the relationships that we build and the rapport that we build and that trust. Something cool that we implemented in the beginning of PATHS, we noticed while working with our Burns community partners, public health, like I mentioned, Nurse Debbie Richardson, who is the epidemiologist nurse, that syphilis was on the rise as well. And in PATHS, there is an S in syphilis, and I'll talk about that a little bit more later, but we were able to get syphilis on the lab forms for all our hospitals that we utilize for testing. And so that kind of opened up this whole door of a way to help in that fight with syphilis as well, along with HCV. Anything to add?
No,
Okay.
you're it.
Oh, another thing I want to touch on is we just recently started implementing and using our CLIA waiver. And so we're able to go wherever we need to go and just test for HCV for rapid antibody on site. And so it's proving really beneficial. And we just are happy to have that tool in our toolbox. I'm going to touch on Peer Heart. This is a really new, exciting study, and we're just happy to see it all go down. It's been a pleasure to see the beginning stages of this, and right now our two peers, Tabby and Shanna, are the ones on this study. So the study was to develop a pilot and peer-facilitated cardiovascular screening for people with methamphetamine use paired with peer-facilitated telemedicine cardiology linkage. BAFS is the only peer organization piloting this intervention. So some key points in this study, you have to have used stimulants or methamphetamines in the last 30 days and then have had prior long-term use of methamphetamine use. So within this study, we're also getting a lot of referrals that people are living with HCV. So we are, interactively working together to get them the services that they need. Another study that we are involved in is PeerCM, a study testing peer-facilitated contingency management for people who use stimulants for harm reduction in self-identified goals. Partners are OHSU, OHA, CoImagine, 9 peer organizations. Study design compares incentives for visits with peer to incentives for visits with peer and for completing self-identified goals. So PeerCM we have about 70 participants right now. Some of them have already closed out. They've reached their 6 months of incentives, and we have others right now that are currently in the study that are active. We've had a lot of good outcomes from this study, just people that would normally never hear the message of recovery or didn't know that working on goals was possible while still using. Is a pretty cool thing to see. We have people that have got into our housing. We've had a few, probably I think six cures for HCV. We've taken them through their whole treatment. We have people that were on the streets are now, housed. We just built some really amazing relationships, and people know exactly where to go. Yeah.
I think one of the most amazing things about PeerCM is we meet with an individual that doesn't have recovery in their mind, let alone has had a self-identified goal in, it's hard to say how long. And we meet with them a few times and we're able to self-identify some goals with them, celebrate small wins. And then the next thing you know, we're meeting with them and they're like, hey, I just got full-time employment. And we're really able to just celebrate those successes and incentivize those visits, so we become so much closer to these individuals and somebody that would have fell through the cracks,
That's right. And meanwhile, every visit we have with them, we're asking them about overdoses. We're asking if they have Narcan, if, how it's looking out there on the streets or wherever they're located. So those visits, weekly visits, are opportunities for us to provide our harm reduction model and to, just like you said, incentivize those goals and let them know that those goals are possible. We have people connected to doctors that hadn't seen a doctor in so long. So it's just a really awesome project to be on.
So some of the things that we've learned and some of the things that have worked. So some of the things that have worked, I'll touch on that a little bit first, is setting up these connection points with our community partners in these rural areas where people are too far to come into our recovery center and access services has allowed us to reach people that normally we don't have the time to get to the far edge of that rural county, right? So we set up at places like food banks, where not only are they're getting their needs met with their food, their hygiene and stuff like that, but we're also able to provide harm reduction supplies and stuff of that nature. And then just spread that seed of recovery, and then some of the things that we have learned, the most beneficial thing that I've learned since working here is I don't have to take everything on myself. I have a solid team with me, whether it be a housing peer, a treatment peer, a director, my supervisor, Brittany. All of us have a passion for what we're doing, right? We all have lived experience. It's peer ran, and every one of us loves what we're doing. So it's really nice being able to lean on each other. A lot of us have really busy schedules, so we're not able to meet with people on a regular basis, like set an appointment time and have it actually come through. Especially being that a lot of the people that we work with are on that schedule of no schedule, you know. I remember being out there and not really remembering what day it was, you know, so it's really hard to come in at 10 a.m. on a Thursday when, you know, our last appointment was, you know, so yeah, I think that that's really nice, learning that, you know, the team really holds each other down, you
That's
know.
right.
I think that's beautiful.
It is. So as I mentioned earlier, I brought up addressing the S in paths. And I came up with this in this little slogan at the Prime Convergence in 2023. We were going to talk about what we had going on with paths. And so in the beginning of when we first launched paths in May 2023, I didn't hear much about syphilis, even though the S was in paths. And so this inspired some new inventive ideas and relations with our community partners. As I mentioned earlier, Nurse Debbie Richardson with Public Health, she was attending all of our outreach events, and I had heard that syphilis was on the rise, and we were having positive cases come up at these outreach events. And so I asked our PATHS team if we could put syphilis on our lab forms because we had a way to treat. And so this proved really beneficial, and this opened up this new idea that because us peers could go into all these places that Nurse Debbie couldn't, that we could, and we could bring them to her, and she could come maybe outside, and then we could bring those people outside, and she could do the testing, and then we would help with the confirmatory testing. One of the really cool things that came out of this was Nurse Debbie went back to her superiors, and they got it to where Nurse Debbie could treat syphilis on site. So we go, she comes where we go, and we bring the people to her, and we go into these houses that nobody really wants to go into these environments that nobody wants to go in at all. And Nurse Debbie was able to make it to where she could, like I said, test on site and treat on site. As of now, I think that we are the first team to really do that in the state of Oregon. And our hope is that other people in other places would model this idea that a public health nurse or a nurse would go with peers to test for syphilis and then treat on site. And us peers would help getting them to the lab for confirmatory testing. So this is something that we're really excited about. So if you guys have any questions, want to reach out, feel free to reach out to me. This is my contact information, and this is my supervisor, Paul Gonzalez's contact information. I just know that we're super grateful to be here and to be a part of this. I never thought that I would be doing something like this 3 years ago, even though I had some hope in my heart that I wanted to help others. And I just can't stress enough how grateful I am for all the people that have poured into this across the state of Oregon, and to be a part of this collaborative effort to save lives, reduce overdoses, to stop overdoses, to eliminate HCV and HIV and syphilis and all these things that are wreaking havoc on our communities and our loved ones. And
Yeah, it really just kind of shows that the the housing first model isn't the only model that works.
Yeah.
Right, harm reduction, humanizing somebody's situation, those are things that are extremely important on the path to recovery. You know, awesome to be able to recognize those.
Thank you.